Are you experiencing fluid retention, also known as edema, due to conditions like heart failure, liver disease, or kidney issues? If your doctor has prescribed Enbumyst, this video will provide essential information to help you understand your medication and use it safely and effectively. Enbumyst is a brand-name nasal spray containing the generic medicine bumetanide. It's a loop diuretic, often called a water pill, designed for the short-term treatment of edema in adults. This innovative nasal spray offers a convenient, once-daily administration. It's specifically approved for fluid retention associated with congestive heart failure, liver disease, and various kidney conditions, including nephrotic syndrome. Enbumyst was approved by the FDA on September 14, 2025, marking a new option for managing edema. Enbumyst contains bumetanide, a powerful loop diuretic. It works by targeting specific areas within your kidneys. This medication inhibits the reabsorption of sodium and chloride. By acting on the proximal tubules, distal tubules, and the loop of Henle, Enbumyst promotes rapid fluid removal. This unique mechanism helps reduce excess fluid in your body. It works independently of other systems, ensuring a focused diuretic effect. Like all medications, Enbumyst can cause side effects. It's crucial to be aware of these and discuss any concerns with your healthcare provider. Your doctor can help you manage potential reactions. Some common side effects you might experience include dehydration, which means low body fluid levels. You might also notice headaches, muscle cramps, or dizziness. Other common effects can be low blood pressure, hypotension, and nausea. For patients with liver problems, hepatic encephalopathy is a possible side effect. Always report any bothersome or persistent side effects to your doctor. They can offer guidance and support. Enbumyst is a diuretic, meaning it causes fluid loss, which can lead to serious fluid and electrolyte imbalances. Too much fluid loss can result in dehydration and decreased blood volume. This can increase your risk of developing blood clots. Blood tests are essential during your treatment with Enbumyst. These tests help monitor for abnormalities like decreased salts, electrolytes, or increased nitrogen, glucose, and uric acid levels. Elderly patients, those on higher doses, or individuals not getting enough electrolytes orally are at higher risk. Do not use Enbumyst if you have severe electrolyte loss until it improves. It's vital to recognize and report certain warning signs to your healthcare provider right away. These include unusual thirst, dizziness, or lightheadedness. Also, watch for weakness, tiredness, or a fast heart rate. Other critical signs are a dry mouth or tongue, sudden joint pain, especially in your big toe, indicating gout, or leg pain, swelling, or warmth, which could signal a blood clot. Shortness of breath, high blood sugar symptoms, dark urine, muscle cramps, or confusion also require immediate medical attention. Beyond fluid and electrolyte issues, Enbumyst carries other serious risks. These include the potential for kidney function deterioration. There's also a risk of ototoxicity, which means ear damage, hearing loss, or ringing in the ears, tinnitus. These risks are generally higher in elderly patients and those receiving higher doses of the medication. It's important to note that the safety and effectiveness of Enbumyst in children are not yet known. Always consult your doctor for medical advice regarding side effects. Enbumyst is not suitable for everyone. There are specific conditions where its use is absolutely contraindicated. You should not use Enbumyst if you have anuria, which means no urine production, or severe oliguria, which is very little urine production. Additionally, if you have a known allergy to bumetanide or any other ingredients in Enbumyst, you must not use this medication. Always inform your healthcare provider about all your medical conditions and allergies before starting treatment. Before you begin using Enbumyst, it's crucial to have a thorough discussion with your healthcare provider. Share your complete medical history and any current health concerns. This ensures the medication is safe and appropriate for you. Inform your doctor if you have existing electrolyte imbalances or follow a low-salt diet. Also, mention if you have diabetes mellitus or chronic diarrhea. Any nasal conditions such as polyps, previous nasal surgery, a broken nose, or congestion should also be disclosed. If you are pregnant or planning to become pregnant, discuss this with your doctor. It is not known if Enbumyst will harm your unborn baby. Your healthcare provider will weigh the potential benefits against any risks. If you are breastfeeding, it's important to know if Enbumyst passes into breast milk. If you use Enbumyst while breastfeeding, carefully watch your baby for signs such as urinating more than usual, dehydration, unusual sleepiness, drowsiness, or sluggishness. Using Enbumyst correctly is vital for its effectiveness and your safety. Always refer to the detailed instructions for use leaflet that comes with your medication. If you have any questions, do not hesitate to ask your healthcare provider or pharmacist. Enbumyst is designed for use in the nose only. Each Enbumyst device contains a single spray of medicine and cannot be reused. It's a single-use device, so discard it after one application. Your prescribed dose will determine how many nasal spray devices you need to use. For a 0.5 milligram dose, you will use one device. If your doctor prescribes 1 milligram, you will use 2 devices. For a 1.5 milligram dose, 3 devices are required. Finally, a 2 milligram dose means you will use 4 separate devices. Always follow your doctor's specific instructions regarding the number of devices. Remember, Enbumyst devices are single-use only and cannot be reused. There is no need for priming or testing the device before use. Enbumyst is available in cartons containing either 6 or 12 devices. This medication is intended for short-term use only, for single treatment episodes of edema. Your doctor will aim to switch you to oral diuretics as soon as it is practical. This ensures continuous and appropriate management of your condition. Enbumyst is administered via the nasal route only. Your doctor will carefully individualize your dosage based on your specific response to the medication. This personalized approach ensures you receive the most effective treatment. The recommended dose for edema in adults ranges from 0.5 milligrams to 2 milligrams, administered once daily. It's important to reiterate that Enbumyst is not intended for chronic, long-term use. Your healthcare provider will transition you to oral diuretics as soon as your condition allows. It's crucial to inform your healthcare provider about all the medicines you are currently taking. This includes prescription and over-the-counter medications, vitamins, and herbal supplements. Enbumyst can interact with other drugs, potentially causing side effects or altering their effectiveness. Be especially sure to tell your doctor if you are using other nasal sprays or water pills, diuretics. Also, mention if you take lithium, probenecid, or indomethacin. Certain antibiotic medicines, specifically aminoglycosides, and medicines to treat high blood pressure, can also interact with Enbumyst. Keep an updated list of all your medications to share with your healthcare team. Proper storage of Enbumyst is important to maintain its effectiveness. Store Enbumyst at room temperature, specifically between 59 degrees Fahrenheit to 77 degrees Fahrenheit, 15 degrees Celsius to 25 degrees Celsius. It is crucial that you do not freeze this medication. Always keep Enbumyst out of the reach of children to prevent accidental ingestion or misuse. The active ingredient in Enbumyst is bumetanide. Inactive ingredients include benzyl alcohol, carboxymethylcellulose sodium, mannitol, potassium hydroxide, hydrochloric acid, and water for injection.